name is Catherine, and I am going to talk to you about fentanyl, the deadly designer drug. Fentanyl is a Schedule II highly potent narcotic analgesic and attended the family of synthetic opioids. This drug has been known for its potency and has been calculated to be 200 times more potent than morphine, another type of opioid. There are currently around 100 different active forms of fentanyl being synthesized, both legally and illicitly. Fentanyl has been commonly used in replacement of heroin because the compound is more potent, easy to synthesize, and costs much less to produce. Many illicit drug producers have been mixing fentanyl into other common street drugs such as MDMA, meth, cocaine, and heroin, and often without the user's knowledge. There are 4 main forms that fentanyl can be found in. It can be found as a pressed pill for oral administration and a vial as a liquid for intravenous injection, small transparent transdermal patches, or in crushed powder form in which the substance is heated and its smoke inhaled. For legal medical uses, transdermal patches and liquid vials are the most common forms of delivery. However, among illicit drug users, pressed pills and powder forms of fentanyl are the most popular forms. Like many other opioids, fentanyl works by binding to the brain's opioid receptors. These receptors are found in the regions of the brain where emotion and pain are controlled. The effects of fentanyl mimic those of other opioids. Some common physical effects elicited by fentanyl include nausea, relaxation, constipation, sedation, and slowed breathing. On the other hand, mental effects that can be felt by the user include euphoria, drowsiness, confusion, unconsciousness, and in some cases, hallucinations. There are many risks that fentanyl poses. Fentanyl is a highly addictive substance, and the human body can quickly build dependence even after a couple hours after administering the drug. This quick dependence often leads to physical and mental addiction. Fentanyl acts very quickly in the body, and withdrawal symptoms, along with its side effects, can be seen just hours after the drug consumption. These symptoms include muscle and bone pain, problems with sleep, diarrhea and vomiting, cold flashes, uncontrollable muscle twitches, and even seizures. Since fentanyl targets primarily the brain, there are serious long-term consequences. The user will experience severe depression and mood swings, as well as severe addiction. Taking fentanyl will also increase an individual's risk for anoxic injury, which means that there will be a lack of oxygen supply throughout the body due to respiratory depression caused by the drug. When this state of anoxia is continued, the individual will face multiple organ damage. And if the multiple organ damage is fatal, it will lead to systemic organ failures and even death. Because fentanyl is so potent, there has been tremendous cases of reported deaths related to it. The minimum lethal dosage of fentanyl is only 250 micrograms, which is only 0.25 milligrams, and this is a very small amount compared to other opioids. This potent drug was soon being produced illegally, and this illegally made fentanyl was quickly distributed, exponentially increasing the public's accessibility to this dangerous drug. In part because of this accessibility and its low prices, the rate of reported overdose deaths have increased 10% within just 1 year between 2017 and 2018. There are over 31,000 cases of fentanyl-related deaths per year, and 67% of all opioid-related deaths have been reported to be due to synthetic opioids such as fentanyl. The graph on the left is a visualization of the seemingly exponential increase of fentanyl-related overdose deaths between the years of 2012 and 2018. Fentanyl, as I have stressed, can be fatal. Therefore, if you notice any of these signs, you must quickly call 911 and administer naloxone if available. Signs of an overdose include slow or shallow breathing, slow heartbeat and weak pulse, cold clammy skin, severe disorientation, unresponsiveness, loss of strength, and muscle stiffness. Knowing these signs can save a life. Thank you for listening, and I hope you stay healthy and safe.